once I started practicing mindfulness, I realized, wow, the mental health field is so pathology oriented.
Yeah.
Right? So as a clinician or as a student, it was like we learned how to make diagnoses. We learned about negative family dynamics. We learned about negative couple interactions and the loop that
Mm.
couples get into, which are all important
Yeah,
to
yeah.
understand.
That's not the whole
But
picture.
no, that's not the whole picture. And also, as students, or mental health practitioners, we're always studying the latest diagnosis or the latest negative dynamic, right, to understand phenomenon. So it's really from a perspective of lack.
Yeah.
Right? So that's one thing that I really, really realized of what the field that I had been in. And I think I was a competent therapist because I worked with people and I thought about their strength in a lot of caring and listening.
Yes.
And yet the field itself is very problematic.
Right.
And then we start thinking that we're smart as therapists because we understand what the negative dynamics
Yeah.
are, or we can tell between this diagnosis and that diagnosis, or this personality disorder, or that personality disorder, which, personality disorders is a real negative, very hurtful framework to
Yeah.
judge a person, right?
Yeah.
It's people's survival skills.
Mm.
So that's one thing that I think mindfulness contributes to mental health and
Yeah.
well-being is what kind of labels have you been given by people?
Yes.
What kind of labels have you accepted by society?
Yeah.
So that to me has been very, very helpful.
Yeah.
Mhm.
So using mindfulness in terms of mental health, one thing is to recognize we're more than a diagnosis someone gives us or not,
Right,
and it's not we are not that whether
right.
depression or it's like yes we're having all these symptoms and yes sometimes I remind people all the diagnostic criteria are
Mhm.
helpful in terms of communication between professionals so we know oh we're talking about this and then
Right,
we can work on treatment but it doesn't mean the person is that
right,
that
exactly.
this is and there's that's it this is all there is you are this type of diagnosis
Right,
you're this disorder I just yeah it just doesn't never
right.
sat with me this
Yeah.
yeah
So we're living with symptoms of depression, but that doesn't mean we
yeah
are a depressed person,
yeah
right? Yeah, I was reading recently that the diagnoses for children, psychological issues, doubled in the whatever 10 years, the
Yeah.
different diagnostic categories, you know?
That's a
And
lot.
yeah, and I'm not to take away from how that has helped understand certain
Right.
issues, right? And
Right.
it helps parents understand and it helps children, the child themselves understand,
Yeah.
oh, this is the area that I have difficulty with. So I'm not trashing diagnoses, but when you only get into diagnoses, then that's when you can really lose the sense of humanity.
Yeah.
Yeah,
Yes.
yeah.
Yeah, absolutely. So then I guess the sense of humanity when someone does practice if they are or want to explore mindfulness
Mhm.
is seeing themselves as more whole, seeing the humanity in
Right,
themselves rather than just a broken part because of a
right.
diagnosis. So
Yeah.
yeah, yeah. Hello there, and thank you so much for stopping by this channel. I hope you find this content useful, and if you do, feel free to hit that subscribe button. It will really help me to reach to more people and keep this content going. Here we are journeying together, and let's see where this takes us.